So we're proceeding on our obstetric classes, and for the next one, we'll actually like to look at some approaches towards giving birth. So in giving birth, probably you might have seen the doctor doing some hand signs on the tummy, and you might actually want to wonder what they are. So these are the things that are known as what? The Leopold's maneuvers. Now, this image is showing the baby, but in a normal woman, you will not be seeing the baby. Do you understand? So that means the doctor, right, probably he knew the position of the baby from like ultrasound that was done, or the palpation he made. All right, he tried to like locate the head and all of that. So there's a first maneuver you do, there's a second maneuver you do, there's a third maneuver you do, there is a fourth maneuver you will do. This another one. All right, so let's get to discuss all these maneuvers so that mothers can now know what doctors are doing to their tummy. All right, it's not magic. All right, so for the Leopold's maneuvers, we said that there are a set of 4 systemic techniques. So there are 4, right? So they are used by healthcare professionals, especially in obstetrics. All right, and they are done to actually access the position of the baby, to know the presentation of the baby. Is the baby coming with the head down, or is it coming which part of the body towards the cervix? You understand? So also you are trying to know the engagement of a fetus during pregnancy. So this can help you dictate a lot of things. If giving birth through the vagina will be possible, if possible complications will come up. Do you understand? So they are named after a great obstetrician known as what? Christian Gerhard Leopold. He was a German obstetrician who introduced them in the late 19th century. So looking at the different types now, I'm wondering which image we should use, which one is more clear. Let's start from here, because it's basically the same thing. This one, you're holding the baby from the buttocks. Are you following? So the first one is the Fundal Grip. The examiner palpates the top of the fetus fundus. All right, okay, top of the uterus fundus, like the part of the uterus, right? This one up here is a fundus. So if you are palpating the fundus, of course you are palpating the buttocks of the baby. All right, so you are doing this to determine which fetal part is present. Do you understand? At that side, is it the head or buttocks? Of course, normally it should be the buttocks. Anything that makes you feel the head around that place, there's an abnormality. Do you understand? So they are just maneuvers that help us to know, if the baby will be giving birth rightly or not. All right. Then the lateral grip, that's the second maneuver. That one, you're trying to feel the back of the baby. All right. So the back shouldn't be that way. The back should always be this way. You understand? Some things must just be right for a mom to actually give birth properly. So hands are placed on either side of the abdomen to locate the fetal back and a small part like the limb. So this helps to determine how the fetus is placed or oriented. Okay, let's go to the next one, which is the third one. That's a C. The C, which is known as the third maneuver, is known as the Pawlik maneuver. So that one, you're feeling the head. If the head is coming towards the cervix, all right. So it's a Pawlik maneuver. We say that the lower abdomen is palpated just above the pubic bone to identify the presenting part. So normally, in a normal baby, it should be the head. All right. So the fourth one now is the what? Pelvic grip. All right. So this one, we say that facing like can you see that the examiner is going towards the back to face the mother's feet. All these ones, examiner was standing facing the head. If you notice, the hands are now from the front to the back. Now you get. So facing the mother's feet, the examiner uses both hands to determine how far the presenting part has descended into the pelvis. Like how far is the baby going down? So this can help you know when the mother will possibly give birth. You understand? So these maneuvers are especially useful in late pregnancy, all right, to help plan for delivery. While ultrasound is more precise. But Leopold's maneuvers remain a valuable tech skill. All right. So if you see a doctor doing this, that means the doctor is experienced. You understand? But lazy doctors, they might just want to use ultrasound. But in as much as we have machines coming in to ease our practice of medicine, we shouldn't leave the, how will I put it, we shouldn't leave the old ways that brought us this far. Okay, so this is just what the Leopold's maneuver basically mean in obstetrics, giving birth, labor, and all of that.